there. I'm Gladys Gregory, a psychiatrist that's in the Nashville area, Gallatin, Tennessee, 30 miles north of Nashville. And I trained at the University of Miami in psychiatry and neurology. Got boarded in that decades ago. Feels like the dark ages now. But I continue to get lots of information from the American Psychiatric Association, American Medical Association. And so I wanted to do this little video because so many people are stressed out right now going through the COVID pandemic. So I kind of entitled this just Staying in Control, dealing with anxiety, dealing with depression. We've heard more and more information about suicides going up dramatically during this time period. So that's what prompted me to do this little video, okay? I put my email address there. I've learned a lot from the patients. I hope the patients learn a lot from me. So I'm sharing some of their coping strategies as well as a little bit of medical advice. And I'm hoping that if you've learned a lot of good coping strategies over these last 6 to 8 months, maybe you will share them as well. And my cell phone number is there. Okay, so the first thing I want to talk about is sleep. Sleep is absolutely critical. We know that the incidence of domestic violence, car accidents, job-related injuries, all of these go up dramatically when people are not sleeping properly. One of the things that greatly interferes with sleep is, of course, anxiety and depression. So first I want to talk about some holistic herbal remedies for sleep. And basically, whatever I discuss here today, we'll need you to run it by your physician, your family medicine doctor, your internist, who knows a lot about your health, knows about drug-drug interactions, because the herbals in general are much healthier. They're quite safe compared to so many prescription medications, but yet there's still the possibility of some interaction between the herbals and your prescription medications. So please be careful. Okay, the first sleep aid that I want to discuss is melatonin. The body naturally produces melatonin. So basically this is a supplement that runs about $8 a month, and it can help a person to really fall off to sleep in a hurry. Now the good thing about the melatonin is that it has been thoroughly researched and found to be very safe for children as well. So basically around 5 years old, but do your research about that if you choose to use it in children, and run it by their pediatrician. They have the melatonin in all different forms. Sublingual is the type I like the best. Dissolves under the tongue, acts in a hurry. Other people like it in the liquid form or the gummy bears. But it's a very nice supplement that will help you to unwind and fall off to sleep in a hurry. Now, melatonin doesn't always keep people to sleep during the night. And so what I like to suggest to go along with the melatonin is valerian root. Has kind of a disagreeable smell, like moldy cheese, but just following the directions, 3 capsules a night, and you combine that with the melatonin, you fall off to sleep in a hurry, and usually sleep quite well throughout the night. Now another natural remedy that's now in Walmart. Many years ago you could only find it in the health food store, and this is called Calm, and it's mostly magnesium, which is like the Epsom salt, which is mostly magnesium. These things help you to relax and to be calm, and basically just follow the instructions, because anyone who gets too much magnesium usually leads to loose stools. But magnesium is a critical supplement that helps with anxiety But beyond the anxiety, it's actually a critical mineral that's needed for the nerve cells themselves and the nerve fibers. So consider that. I think it is $10 a month, most places. Okay, so I want to discuss a couple of prescription medications that generally run from $4 to $15 per month. I'm sure you're well aware of tons of people that have been laid off during this COVID pandemic, and so many don't have health insurance these days. So you'll find that the majority of the larger chain pharmacies, such as Walmart, Walgreens, CVS, Kroger, most of them have the $4 list of medications. So one that's on there is Trazodone. It's usually always listed. And Trazodone is a prescription medication, and it came out in the late 60s for depression. But then over the decades, the psychiatrists saw that it's not real effective for depression. So it's mostly just used for sleep. Usually at a dose of 50 to 100 milligrams, but you and your physician will figure that out. So it's a very nice medication. Please read the potential drug-drug interactions and side effects, but we find it to be a quite clean medication overall. Along the lines of anxiety and depression, there's a medication, I think it's the favorite medication in terms of an antidepressant for me. A very clean medication that's been around for, of course it has its side effects too, so relatively clean. I think in 20 years I've only had 2 people to say that they had any side effects to this particular medication. Wellbutrin, which is also the generic bupropion, is used for a number of different things. At first it had FDA approval for depression, then for anxiety. So some people are actually using it now for a third indication, which is smoking cessation, and it goes by the name Zyban. And of course, there's more and more smoking going on because people are really anxious and nervous during this time period. Nobody's experienced such a pandemic before. But the tobacco, of course, it's become more and more toxic. So there are up to 100 different chemicals that are used in the tobacco processing these days. So basically, there's a lot of kidney failure and even some kidney cancer that's associated with it. So if you want to utilize this medication or discuss it with your physician, it really can address a number of things. The anxiety, depression, smoking cessation, and actually some of the off-label uses of it has to do with attention, concentration. We find that a lot of parents that don't want their children on Ritalin, like for ADHD, we tend to use the Wellbutrin as well. So just consider that. I think currently it's $15 a month without insurance at Walmart. So the other thing that we suggest you do on a nightly basis, which I generally do morning and night, is to listen to something inspirational or motivational. So YouTube is like a good friend. They have so many videos. So you can go there and listen to the I Am affirmations. Some of them are from a psychology perspective, like the power of positive thinking. Others are from a scriptural perspective. And we asked you to do what the therapist typically asks people to do, which is to repeat these things out loud. Because saying things out loud basically helps to reprogram the subconscious mind, helps to get rid of a lot of fears, some that have been embedded even since childhood. So basically, I just wanted to share those few pointers. So you can give us some feedback at that email. Share with us some of the things that you're doing in terms of coping during this pandemic. And then we'll share with others. So thank you so much for tuning in.